To discuss more, we have with us on the show via Zoom infectious disease expert Dr. Rontgene Solante. Dr. Solante, welcome to The Big Story.
Hi, Robbie. Good evening.
Dr. Solante, maybe first you could bring us up to date on all of these new variants. What do we know about them, and what is your level of concern?
Okay. What we have now, I think, this is already the BA.5. More of the BA.5 over that of the BA.4. Why? Because if you look at our sequencing data from the Philippine Genome Center, although we are in a country with a very low numbers of sequencing, but if you sequence like 100 specimen and you see 60% of the specimen are positive for that BA.5, then you can just imagine that this may be the one driving the increase in the cases. And we know that BA.5 is really highly transmissible. For that reason alone, at the same time, it can also evade our protection in terms of getting the vaccine and previous infection. So we have three clusters of cases now. One, for those unvaccinated getting the first infection. Second, for those fully vaccinated and boosted getting a breakthrough infection. And number three, those who had previous infection and now getting a reinfection. So this is always expected. We have a lot of these cases now, expected. But the question is, are our healthcare utilization overwhelmed? Are the hospitals overwhelmed? So that means a lot for us, because if anything else that we can always look at as something grim and have to panic if people are going to the hospital and dying. But we are not seeing that in these new variants of concern.
Okay, maybe you could get into some details there and what we actually know. How are these infections translating to, one, hospitalization, and two, mortality?
Okay, now, reinfection is known to be dangerous over the breakthrough infections, because in most cases, if you have a reinfection, you are having the more inflammation in your body. And who are the vulnerable? These are the elderly population and those who has comorbidities. And that's why they are the ones should be prioritized when we do testing. That is, the intention there is to treat them with antivirals or monitor them, that they will not go into severe cases because of the higher mortality. So that's, I think, we have to focus on this vulnerable population. For the rest of the general population, they will always have mild symptoms, but they have to be careful because they can also infect their vulnerable population at home or even at the workplace.
Now, Dr. Solante, complicating our public health situation, tumataas din po ang numbers ng dengue. What's the situation there?
Our dengue cases now, if you compare it last year, so that's usually how we compare it, it's already above the epidemic threshold. So meaning more cases that we have seen so far compared to last year. And almost all regions, or only 3 or 4 regions, are left without the dengue cases. So for me, that's also alarming. Now, the question then is, what is the case fatality rate of dengue? The case fatality rate of dengue is usually among the children, okay? And that's what we want to protect. What is important here, we have to educate all the parents, educate the people that when they have symptoms compatible with dengue, they have to check with their doctor, because early recognition, early diagnosis will be very crucial for us to clinically manage them before they will go into severe form of dengue.
Now, of course, every time we talk about dengue, we have to be reminded about, this word that entered everybody's consciousness, but in the context of COVID. But remember, we were talking about dengue and vaccination as well, particularly dengue, which was very controversial because on the one hand, it was experimental. At the same time, this also led to a lot of distrust and mistrust for vaccination in general. Remind us, sir, and bring us up to date. Ano bang situation sa vaccination for dengue and dengue in particular?
Okay, so there are already other vaccines, aside from dengue that has undergone phase 3 clinical trials, and it's just a matter of time that they will also be available in most of the countries where dengue is really prevalent. So I'll just give you an idea here. There are 390 plus million of dengue cases worldwide for each year. And 70% of the 390 million are in Asia. Okay. Now, which country needs this vaccine? Because when you look at strategic control of dengue, yes, I agree there should be environmental control or hygiene. You take out the breeding places of the mosquito. At the same time, you also manage the case, early recognition. But for several years now, we've been doing that, and did it affect and did it change the scenario? Did it change the number of cases? Okay. What we are doing now, what we are looking now as an ID physician, we always look at vaccine as an important option. Okay. But the problem here is because we don't have a vaccine available now in the Philippines because dengue vaccine has been suspended. And although in neighboring Asian countries, Robbie, it has been licensed, Thailand, Singapore, Vietnam, Indonesia, these are countries using this vaccine. The question is, the Philippines doesn't have that because of the legal matters related with this dengue vaccine. So what I'm not promoting a dengue vaccine. I'm just looking at it in the context of an infectious disease specialist that we need vaccines, whether it's dengue vaccine or other dengue vaccines. I think there is a call, especially for me, that DOH should also look at on the possibility of available dengue vaccines that can also be accessed by Filipinos.
Okay, Dr. Solante, in the meantime, in the middle of all of these problems, wala pa rin pong health secretary. What is the implication of not having someone at the very top of the public health system, at least bureaucratically, and in terms of the IATF, for example, in terms of strategies, how are we hamstrung? And at the same time, what are still the possibilities, notwithstanding not having a Secretary of Health?
Without the Secretary of Health, all the policies that the previous administration have are currently being used by the government. Second, there's nobody there that will really give important direction on what's the next step, especially confronting with these cases of dengue, cases of COVID-19. So for me, it's important when you have the head of that Department of Health that will really give you direction. And at the same time, you need someone there to make critical decision on what direction are we going to prioritize at this point with all these problems of of health, especially with the surge of cases or increase in the cases and dengue infection. Then I would say it's very critical, it's very crucial. The government should now get someone to really guide us.
Okay, maraming salamat po. That was infectious disease expert Dr. Rontgene Solante.